Did you know that a hidden heart condition could silently affect your life or the life of someone you love without any warning? Welcome back to part 3 of this important series on Hypertrophic Cardiomyopathy or HCM. In parts 1 and 2, we uncovered how this silent heart condition can strike without warning, affecting both everyday individuals and athletes. Today, we are diving into the most pressing questions about HCM, from what causes it to how it can be detected and treated. Understanding these basics could save your life or the life of someone you care about. Let's get started. HCM is caused by mutations or changes in certain genes that control how the heart muscle is built. Think of genes as a building plan for constructing all parts of our bodies, including the heart. When there is a mutation, it's like having an unexpected change in that plan. Imagine if the heart muscle walls are made of bricks, and because of this change in the plan, the body mistakenly adds more bricks than usual. This extra thickness makes it harder for the heart to pump blood effectively. So in a way, HCM results from a genetic glitch that leads to a thicker heart muscle. HCM is most commonly inherited, meaning you get it from your father or your mother. If a parent has HCM, there's about 50% chance they could pass it on to their child. So it's a condition that runs in families. However, it's important to note that not everyone with the genetic mutation for HCM will develop symptoms. Some individuals may actually remain symptom-free for many years, while others may experience complications early in life. A notable example is Sir David Frost, who was a renowned British journalist and television host, who lived a full life until his death at 74 from undiagnosed HCM. Tragically, his seemingly healthy son, Miles Frost, died suddenly at the age of 31 from HCM while jogging. This underscores the importance of knowing your family's health history and seeking early screening if there is a known genetic predisposition. Also, I want to emphasize that not all cases of HCM are inherited from a parent. In some instances, the condition arises due to spontaneous genetic mutations. This means that the genetic change responsible for HCM can occur randomly during a person's development, even if there is no family history of the condition. While hereditary HCM is passed down through families, these spontaneous cases remind us that anyone can be affected. That is why regular checkups and paying attention to any unusual symptoms are so important for maintaining heart health. A notable example of someone who likely had HCM from a spontaneous mutation is Reggie Lewis, a professional basketball player that I talked about in part 2 of this series. Unfortunately, HCM cannot be prevented because it is linked to your genes, something you are born with and can't change. Sounds a bit scary, right? But here's the good news. Even though we can't stop HCM from happening, we can take steps to manage it and reduce the risk of complications. Early detection, regular heart check, and proper treatments like medications or lifestyle adjustments can make a big difference in improving quality of life and staying healthy. So it's not about prevention, it's about staying ahead of the condition with proactive care. The signs of hypertrophic cardiomyopathy can vary widely. Some people may experience noticeable symptoms, while others might not feel anything at all. That's why it's so important to know the risk factors and warning signs that should prompt you to get your heart checked. Let's start with the risk factors. If you have a family history of HCM or sudden unexplained death, especially in a young relative, it's a strong reason to get screened. Also, if you've involved in competitive sports or high-intensity physical activities, this can sometimes trigger symptoms in people with mild or undiagnosed HCM. Regular heart checkups are essential in such cases. Now let's talk about the symptoms. Watch out for things like shortness of breath, chest pain, dizziness, fainting, or a racing, pounding heartbeat, which we call palpitation. These symptoms are especially concerning if they happen during exercise. If you notice any of this, it's a good idea to talk to a doctor about getting an echo to check your heart. Treating HCM actually depends on how severe the symptoms are. For people with mild or no symptoms, simple lifestyle changes and regular checkups might be all they need. But for those with more serious symptoms, like the patient I mentioned in part 1, who struggled with breathlessness, treatment might involve medications, lifestyle changes, or even surgery. For this particular patient, I started by prescribing medication to slow his heart rate, which reduced the workload of his heart. This helped ease his chest pain and shortness of breath. I also advised him to avoid intense physical activities, since those can make symptoms worse or even lead to sudden heart problems. We also had a conversation about being careful with certain medications. Some over-the-counter cold medicines, especially those with decongestants, can raise blood pressure and heart rate. Asthma medications can sometimes have a similar effect. We also talked about energy drinks, which often contain caffeine or stimulants and can also strain the heart. Even common pain reliever like ibuprofen or diclofenac can increase blood pressure and cause fluid retention, making the heart work harder. I suggested that he always checks with a doctor before taking any new medication. Lifestyle changes are another important part of managing HCM. I encourage him to avoid alcohol, manage stress, and follow a healthy, balanced diet. In some severe cases of HCM, surgery might actually be needed. One option is a procedure that removes parts of the thickened heart muscle to improve blood flow. In some cases, doctors recommend a small device called an implantable cardioverter defibrillator, or ICD for short. Think of it as a life-saving safety net that can detect dangerous heart rhythms and correct them with a quick electrical pulse. Finally, I emphasize the importance of regular checkups. HCM is a lifelong condition, so staying on top of it is the key. If someone in your family has HCM, it is also essential to take these precautions and have regular heart screening to catch the condition early. HCM is a condition that can remain hidden, but it's not something we should ignore. Whether you are an athlete, have a family history of heart issues, or know someone who does, staying informed and proactive is crucial. If there is anything I want you to take away from this video, it's the importance of family health history, regular checkups, and paying attention to symptoms, even if they seem minor. Catching HCM early can make all the difference, and small lifestyle adjustments could be life-saving. For those of you who've been following along, thank you for watching. And if you are new, be sure to check out part 1 and part 2 to learn more about the signs, symptoms, and initial stories around HCM. If you found this information helpful, please like this video, subscribe to the channel, and hit the notification bell so you don't miss out on future updates. Feel free to share this video with friends and family. It might just be the information that helps them stay safe and healthy. And as always, If you have any questions or topics you'd like me to cover, leave a comment or reach out. This channel is here to make health knowledge accessible and support your journey to a healthier life. In our upcoming videos, we'll be exploring other silent conditions that you should know about. Make sure to stay tuned. Thank you for watching, and I'll see you in the next video. Take care.